Hi, I'm Kylie. I am one of the nursing students in my last semester in the nursing program at MCC. We are going to give a presentation today over the gastrointestinal system. So I'm going to be talking about the organs involved in the gastrointestinal system and what they do. So I have a little picture here to help visualize this. So this is the start or the beginning of our gastrointestinal system. It begins at our mouth. So when we eat food, we bring it into our mouth and we start to chew it up. As we chew it up, we have these salivary glands that give us saliva that help the process of starting to break down these foods for us. As the food is broken down into a form that we can swallow, it then moves into our esophagus. Peristaltic waves move these food boluses through our esophagus down to our stomach. There is a sphincter here that allows the food to just stay in our stomach so that it doesn't go back up into our esophagus. So in our stomach, this is where the food is held and it is digested. We have enzymes in our stomach that begin to break the food down. So the food is stored in our stomach and broken down into a form that then can be moved into our intestines. There's accessory organs that are involved in the gastrointestinal system, like our liver. Our liver makes and secretes bile, and it also filters our blood. So when the liver makes the bile, it secretes it then into our gallbladder where it is stored. So the gallbladder just stores the bile. And as we're digesting food and our intestines need the bile, our gallbladder will release it into our small intestines. We have our pancreas that secretes enzymes that we need to break down proteins, fats, and carbohydrates. So as the food is broken down into our stomach and ready to move into our small intestines, there's another sphincter here that allows the food to move through it there, but it doesn't allow it to go back up into our stomach. So the food moves down into our small intestines, which are about 20 feet long. In our small intestines, the process of breaking down food continues. There's enzymes that come from our pancreas and the gallbladder, like bile, that continue to break down that food into more of like a liquid consistency. And then our body begins to absorb the nutrients that we need. So then after that is finished, then it begins to move into our large intestines or our colon. Our colon is approximately 5 to 6 feet long, and it can take about 36 hours for the stool to move through the colon or large intestines. And there, the body begins to absorb water from the large intestines. And before we said that the consistency in the small intestines of the stool was more of a liquidy form. So as the body begins to absorb more of the water in the large intestines, our stool becomes more formed. As it is formed and ready to evacuate, then it moves down into the rectum and anus, and then we are able to have a bowel movement. So these are the organs involved in the gastrointestinal system and what they do.
Hi, my name is Carl Freeman, and I'm a nursing student at Miles Community College, and I will be going over the GERD portion of the GI system. So GERD is short for gastroesophageal acid reflux disease. It's actually not a disease, it's a symptom. And what happens is stomach acid flows back into the tube connecting your mouth and stomach, and this backwash can irritate the lining of your esophagus. GERD is mild acid reflux that occurs at least twice a week, or moderate to severe acid reflux that occurs at least once a week. And most people can manage the discomfort of GERD with lifestyle changes and over-the-counter medications. Some people may need stronger medications or surgery to ease symptoms. That's pretty rare. Symptoms include a burning sensation in your chest, usually after eating, which may be worse at night, chest pain, difficulty swallowing, regurgitation of food or sour liquid, and a sensation of a lump in your throat. If you have nighttime acid reflux, you might also experience chronic cough, worsening asthma, or disturbed sleep. You should see a doctor if you experience severe or frequent GERD symptoms, or you take over-the-counter medications for heartburn more than twice a week. So the causes of GERD, GERD is caused by frequent acid reflux. When you swallow, a circular band of muscle around the bottom of your esophagus relaxes to allow food and liquid to flow into your stomach, and then the sphincter closes again. If the sphincter relaxes abnormally or weakens, stomach acid can flow back up into the esophagus, which can cause inflammation. There's many risk factors to GERD, one of them being obesity, others including bulging at the top of the stomach up into the diaphragm, which is a hiatal hernia, pregnancy, connective tissue disorders such as scleroderma, and delayed stomach emptying. Factors that can aggravate acid reflux include smoking, eating large meals or eating late at night, eating certain foods such as fatty or fried foods, drinking certain beverages such as alcohol or coffee, and taking medications such as aspirin. So there's many medications you can take. Antacids such as Tums can be taken 30 minutes to an hour before or after meals. Omeprazole and ranitidine are over-the-counter pills that you could take to reduce acid reflux. And some non-pharmacologic measures are eating small, frequent meals, like 6 to 8 meals a day, and raising the head of your bed at night. And that's all I have. Thank you.
Hi, my name is Brandon Roth, and I am a nursing student at Miles City Community College. I'd like to continue in our group's discussion on the GI system and visit with you about celiac disease. Celiac disease is an immune reaction to eating gluten, a protein found in wheat, barley, and rye. If you have celiac disease, eating gluten triggers an immune response in your small intestine. Over time, this reaction damages your small intestine lining and prevents it from absorbing some nutrients. We call this malabsorption. The intestinal damage often causes diarrhea, fatigue, weight loss, bloating, and anemia, and can lead to serious complications. There is no cure for celiac disease, but for most people, following a strict gluten-free diet can help manage symptoms and promote intestinal healing. So what are some of the symptoms? These symptoms of celiac disease can vary, but digestive signs of symptoms for adults include diarrhea, fatigue, weight loss, bloating and gas, abdominal pain, nausea and vomiting, and constipation. However, for more than half of the adults with celiac disease have signs and symptoms unrelated to the digestive system. Some of these include anemia, usually from iron deficiency, loss of bone density or softening of the bone, itchy, blistery skin rash, mouth ulcers, headaches and fatigue, nervous system injuries, including numbness and tingling in the feet and hands, possible problems with balance and cognitive impairment as well. Of course, there's joint pain, and there's also a reduction in functioning of the spleen. So when should you see a doctor? You should consult your doctor if you have diarrhea or digestive discomfort that lasts more than 2 weeks. Be sure to consult your doctor before trying a gluten-free diet. If you stop or even reduce the amount of gluten you eat before you're tested for celiac disease, you can change the test results. Celiac disease tends to run in families. Also ask your doctor about testing if you or someone in your family is a risk factor for celiac disease, such as having type 1 diabetes, Down syndrome, and Turner syndrome, autoimmune therapy disease, microscopic colitis, and Addison's disease. So what are some of the complications? Untreated celiac disease can cause malnutrition, malabsorption, bone weakening, infertility and miscarriage, lactose intolerance, and even cancers. So diagnosing. There's a couple ways of being tested for the celiac disease. One of that is a blood and genetics testing that can be done. The other involves endoscopy, which cameras are put down through the throat of your mouth, and the doctor is able to see if there's inflammation of the small intestine lining. Treatments. A strict lifetime gluten-free diet is the only way to manage celiac disease. There is no cure. A dietitian who works with people in celiac disease can help you plan a healthy, gluten-free diet. Even trace amounts of gluten in your diet can be damaging, even if they don't cause signs or symptoms. Gluten can be hidden in foods, medications, non-food products as well, so it is important to read labels when making food and consumer products if you have celiac disease. Removing gluten from your diet will gradually reduce inflammation in your small intestine, causing you to feel better and eventually heal. Of course, follow-up care with your provider is important. I want to thank you for your time as I've discussed some of the things about celiac disease, and it will now be our pleasure to hear from another nursing student, Katie Wolf. Katie?
Hi, I'm Katie, like Brandon said. I'm going to be talking about the causes, the treatment, and assessment of constipation, something we've probably all experienced at one time or another, or we have at least heard of. So simply put, constipation is a change in your normal bowel pattern. So everybody's different. So it's normal for you might not be normal for the next person. A typical bowel movement happens anywhere from 3 times a day to every other day. So kind of in that timeline, that's considered normal. So how constipation happens is that the large intestine in your GI system is responsible for absorbing water into your body. So when your stool sits in your colon or your intestine the longer it sits there, the more water that's absorbed. So this can make your stool hard and it can make defecation difficult. So the key when treating constipation is that we want to figure out what your root cause is. So some of the most common causes are a low fiber diet, inadequate physical activity, insufficient fluid intake, not going to the bathroom when you have to, pain meds, other medications that you might be taking that contain irons, and even laxative abuse can lead to constipation. So our bodies have the sympathetic and the parasympathetic nervous systems, and the sympathetic nervous system is our fight or flight mode. So it gets triggered when you're under stress. But unfortunately, when you're under stress, your body doesn't think that you need to do other things, so it slows down your GI motility, and this can lead to constipation as well. Other factors can be like bowel diseases such as IBS, pregnancy, medications, like I said, narcotics, pain pills, iron supplements such as those prenatals. So women that are pregnant or trying to be pregnant, taking prenatals that can lead to constipation. Mental health disorders such as depression, neurologic disorders such as a stroke, Parkinson's, and also your spinal cord injuries are contributors as well. So when you come into the clinic and you're complaining of constipation, the first thing we're gonna do is just do a workup on you, assessing like your frequency and characteristics of passing stool. So when was the last time you had a bowel movement? What's normal for you? Was there any straining or pain or tearing? We'll feel your stomach, we'll listen to your stomach, and just take a really good overall assessment of your medical history. Sometimes if we're further down the line or the physician thinks that it's necessary, we might do an x-ray or an upper or lower endoscopy, so either down the throat or up the rear. X-ray is helpful in determining if you have an intestinal obstruction or a volvulus. So a volvulus is twisting of the bowel. It is really important to intervene with these right away because we don't want to have bowel death with that. So after we kind of do the workup, we're gonna start looking at treatments. So your input is really important. It's just as important as our input. So the goal for us is just to alleviate your discomfort and get you onto a more normal pattern, back to your usual. So a lot of things that are used or implemented are first and foremost encouraging fluid intake. We're going to tell you to take 2 to 3 liters every day unless you have heart problems. Obviously dietary fiber, so things such as raw fruit, fresh veggies, and whole grains, that's gonna help with your motility and getting things moving along. If you're having any rectal discomfort, you can do warm sitz baths, or you can just get over-the-counter hemorrhoid creams. Other things that are really important are physical exercise, because movement, there's this mechanism in your GI system called peristalsis, and it's just kind of like a wave, and that helps push things through your system. So movement promotes this. Scheduled bathroom habits can also help. So whatever works for you. If you get up in the morning and you just need to go try right away, it gets your body into a habit, and just makes things smoother. If you do have any neurological problems, you can do abdominal massage. So you would just take the heel of your hand and you would massage clockwise on your stomach, and that could help move things along as well. The most important thing is just to not be embarrassed if you're experiencing this problem, because it's not normal to not go to the bathroom. Going a week is not normal. Going 4 days, 5 days, that's not normal. So it's just really important to either put into place those interventions such as water, exercise, and fiber. And if that's not helping, then you should make an appointment with your physician.